what we wanted to show with this is that it is feasible to do this comprehensive approach, because obviously the clinic visits are so short, and so the idea of trying to be comprehensive is a wonderful idea, but how do you do it in practice? And so that's where the MSPT is what we call, it's the multiple sclerosis performance test. That's kind of the suite of iPad type things. The nice thing about that is that it's patient administered, so we have like an MA in a room with many iPads around, and so instead of when a patient checks in and they have to kind of have a one-on-one with some sort of medical assistant going through every test for them, you can have 5 people at once doing this, and then if there's like a brief question, you have someone there. So I think that automated approach where patients can administer the things themselves makes it very feasible in clinical practice. So as much as we can kind of translate some of these things that we are used to doing in a way that patients can administer themselves, it makes it more feasible, and I think would be kind of scalable to more institutions. And then the other thing is patient-reported outcomes, consistently getting those, because as we're developing new techniques and outcomes, I do think it's something that a lot of institutions should start adapting, because it helps us understand that kind of quality of life domain. We've been very focused on sort of those objective tests, which are wonderful and very helpful, but we also need to understand, okay, well, this patient's walk time is this, well, what does that mean they can actually do in their life? How is this impacting their quality of life? And so I think adapting those patient-reported outcomes and trying to figure out how to use those, because it's not fully understood at this time, but we need to kind of start using them to figure out how that's going to impact our clinical care. And then with the MRIs, obviously MRI is widely used in MS, and I think that's pretty consistent, but the quantitative MRI components I think are a little bit more nebulous, and so that's something that's a little harder to say is adaptable everywhere, but more places need to be using it so we can understand what's a clinically kind of meaningful change in these measures. So I think there's a couple of things to learn from this. Is one, a lot of this can be feasible, especially if we kind of adapt how we administer these tests, and then not being so focused on just the kind of traditional objective tests we can do, kind of adding in some other measures so that we can get a better picture of our patients.